Yeah, yeah. Hello and welcome to this session on climate change and health. Really a big welcome to you all. This is a session jointly run by the Royal College of Psychiatrists, the Royal College of Paediatrics and Child Health, and the Royal College of Physicians. I'm Adrian James, I'm the President of the Royal College of Psychiatrists, and I'm delighted to be chairing this session. We've got 4 great speakers, 2 here, 1 recorded and 1 live from Bosnia. So it's going to be a really interesting session and time for questions at the end. I'm really proud that our college has taken a real stance on climate change. It's one of my 4 presidential priorities. We've declared a climate and ecological emergency. We've said that we're going to reduce our emissions by 2040 to net zero carbon. And yes, we are measuring them. Somebody said yesterday, if you're not measuring, but you're saying, you're probably not doing and you're probably lying. So I did check and we are measuring. We've also concentrated on social prescribing and on prevention. Prevention obviously is the ultimate eco-friendly thing to do, and it's obviously good for our patients and good for our health systems. There's no health system in the world that isn't creaking at the seams. And we've also said that we were going to work in partnership with lots of other organizations. Great to have Rachel here from the Centre for Sustainable Healthcare. And yesterday, we worked very closely with Climate Cares. So there are lots of people working in this space, and we really do need to work more closely together. So let's go on to our first speaker. I'm absolutely delighted to introduce Dr. Rosie Spooner. She's a paediatrician and deputy chair of the Climate Change Working Group at RCPsych. She's an education fellow at the Centre for Sustainable Healthcare and teacher at the innovative Sustainable Quality Improvement Education Project. So Rosie, over to you.
Thank you very much. And hello, everyone. And thank you very much for inviting me to speak on behalf of children and young people today. I'm really sorry that there are no children and young people on this panel to speak for themselves, but I joined them out on the streets on the Fridays for the Future March last week, and there was 10,000 people out there talking about why this is an important issue to them. So I think we have a really important role in bringing that out for all of us to think about. So first of all, I just want to say that children are uniquely vulnerable to the effects of climate change because of their maturing bodies, their cognitive and physical physiology, and also because their dependency on caregivers. So all of those risks mean that environmental hazards have an increased effect on child health. And already those are inequalities existing around the world, both globally and within countries, that mean that children, if you're born in a particular part of the world, your chance of having a healthy future are tens of times less than if you're born in a richer part of the world. Now, climate change acts as an amplifier to those inequalities. What we see is that children who are in the most deprived areas of the world with the least contribution to climate change are going to be feeling the effects of that climate change at amplitudes more than those people in countries such as ours. However, even within our country, it's no mistake that Ella kissing Deborah was from where she was and was of a minority group, and that was part of the reason why she was so exposed to air pollution and why she died. So I suppose the message here is that public health is really important to child health, and that we as clinicians have a role in trying to think about how we can address that. And we can turn that around by thinking about inequality, not as an amplifier, or climate change could be an amplifier to the inequalities, but actually we could use it as an equalizer. So some of the co-benefits of trying to address climate change as a health issue can actually bring around changes that are really positive for child health. So I'm going to start talking about those at both an individual level. So what you as an individual in your personal life and then in your professional life might be. So personally, we probably are quite familiar with some of those changes that we can make on a personal level. But quite soon you realize that probably the average carbon footprint of a doctor in the UK might be somewhere between 8 and 12 tons per annum. But actually that's quite limited in terms of, say you reduce that by 4 tons, you're not going to really contribute to the issue here unless you start going outside of that role and thinking about your role as a physician. And in your role as a physician, what I would encourage you to do is find the carbon hotspot area of your practice. So say you're in a certain specialty, look at where the biggest impact might be. So in paediatrics, what we know is respiratory care is usually our carbon hotspot because of the way that the inhalers we use have a high impact through the hydrofluorocarbons involved in the inhaler. So what can we do to address that? We can't just take away those medicines. That would be obviously damaging to child's health. But if we use prevention, we can make massive impacts on the, we can both prevent ill health by making sure that children are informed about the triggers for them. So making sure they know about air pollution. We can empower them to use their inhalers correctly. We can think about how we can reduce their exposure. So making sure we're talking at every opportunity to think about what is causing those things. So if they're smoking in the household, etc. And then we can try and switch to the lowest environmentally damaging inhalers that we can. So those are principles that you can use in clinical practice. At health system level, we can think about what we as a voice as clinicians or health professionals can do. So I personally went to my chief exec in my trust and said, look, what are you doing? What is our plan? And sometimes trusts already do have a plan. They didn't at that time in 2019 have an active plan, but they agreed to declare a climate emergency, set up a task force and found money to pay for someone to try to fulfill that role. And in doing that, they were actually awarded 13.7 million from the public sector decarbonisation fund. So I think my message for those people who are in management is actually some of these benefits that we can feel by trying to adjust and change to a more sustainable healthcare system can have financial gain for you as well as health gain. So there's a really good message there that it means that we could be, improving the services that we're delivering. And then finally, at a policy level, we have a role as health professionals to speak up, to speak out and ask. We only present about 5% of the country's carbon emissions, but also globally about 5%. But we have a role to talk about what is happening outside of that sector. We need to talk about fossil fuels. We need to talk about reducing those fossil fuels so that everyone can try to live in a much cleaner and healthier environment.
Okay, well, thanks very much, Rosie. That's fantastic. So it is an inequality issue. It's a poverty issue. There are things that you can do. You can look at your own practice. You can look at those carbon hotspots. You can be active, proactive, approach your organization, find out what they're doing and make sure that they're doing it. It can work for them as well as working for the planet. So thanks so much, Rosie. So let's now move on to Stephen Holgate. Stephen is a consultant physician and RCP special advisor on air pollution and the UKRI and Met Office Clean Air champion. Stephen will explain how this is exacerbating health inequalities with the poorest and most vulnerable, often living or working in the most polluted environments. So we've got a recorded session from Stephen. So hopefully that will come on the screen now.
My name is Stephen Holgate, and I'm going to talk about air pollution and human health. Everyone has a right to breathe clean air. Indeed, they have as much right to breathe clean air as they do to drink clean water. And this was clearly recognised back in 2018, when air pollution was suddenly appreciated to be causing as much damage to human health as passive and active cigarette smoking, as can be seen in this pie chart. And the World Health Organization is now pushing ahead with trying to clean up the air by setting guidelines that I'll be talking about a little later on. So what are we talking about here? We're talking about gaseous pollutants, but in particular, particulate pollutants, really small particles, less than 10 or less than 2.5 micrometer in mass median diameter. And these microparticles, when breathed in, enter the lung, pass through the lung into the circulation, where they can cause damage to multiple organs. In the bottom right-hand side of this picture, you can also see that the particles can exist in even smaller sizes called ultrafine particles, or P0.1. and these largely behave like a gas. The important thing about these air pollution particles is that on their surface, they can contain a variety of chemical substances, metal oxides, semi-volatile chemicals, and all sorts of other materials that can be picked up from the atmosphere before they're breathed in. So these are the particles that cause the damage to human health. And this was clearly recognized by the European Commission back in 2021, because obviously it's these particles that are beginning to shorten the lives of European citizens by accelerating the progress of non-communicable diseases. And in this bar, you can see that the declaration here that air pollutant particles causes millions of premature deaths across the world, as is the current situation. But it's not just any old particle that does this. As we can see in this slide, it is particles derived from fossil fuels in particular that are the real problem. And these are the highly toxic particles that we largely get from our urban environments, from the burning of fossil fuels, largely by the internal combustion engine. They're not the only pollutant particles, of course. Forest fires and other toxic particles emitted from industry can cause quite a lot of damage as well. But most of the attention now is being focused on fossil fuel related particulate and gaseous pollutants. Now, if we look at the actual epidemiology that links air pollution to adverse health, we can see that in these very large studies involving multiple millions of people, this being one conducted in the Medicare population in the US, that the all-cause mortality reflected on the vertical axis as hazard ratio, here for PM2.5 and for ozone, the line passes through 1. This is a logarithmic scale. Therefore, this means that if it was a linear scale, the line would pass through 0. That basically means there is no safe level of air pollution at whatever level is generated in the atmosphere. So this really is one of the most important things we've now got to come to terms with. There is no level of air pollution that is safe. Moreover, as seen in this and many other studies now, most of the people who suffer the effects of air pollution the worst are those that are living in racial minorities, the underprivileged, and those that are living in poor parts of our communities. And they, of course, have other health risks that are driving non-communicable diseases as well. And air pollution just feeds in to all of those, accelerating the progress of their disease. And by their disease, I mean diseases in multiple organs, as shown in this diagram. When the air pollutants penetrate the lung and get into the circulation, they go to every organ of the body. And here they accelerate the aging process, whether it's the brain, the lung, the heart, or any other organ. And that's why the non-communicable diseases are accelerated when exposed to air pollutants at the levels I've just spoken about. And a terrible example of the effect of air pollution in human health came with the announcement last December that air pollution was a major contributory factor for the death of a 9-year-old child, shown in this picture, Ella Kissy Deborah. And indeed, the coroner of the South London Coroner's Court at that time thought that this was such a serious situation that the air she was breathing in that part of London was obviously affecting her asthma very severely, and that this would obviously have implications for other people and other cases. So the WHO have now looked at all the new epidemiology that's available, and as a result of this have even reduced the threshold at which we should be acting for air pollutants. And in this table, you can see for PM2.5 on the left and NO2 that were previously set in 2005 at 10 micrograms per meter cubed and 40 micrograms per meter cubed respectively, have been lowered further to 5 and 10. Here in the United Kingdom, we actually are operating at a level of PM2.5 of 20 micrograms per meter cubed. So what's being recommended now is a reduction down to 5, which is obviously far, far lower than we're currently being exposed to as a population. And of course, when I say exposure, I mean exposure across the life course. On the left-hand side, you can see a diagram of a 24-hour recording of particulate exposure of an individual. And you can see that at different times during the day, the individual is exposed to different levels of pollutants and indeed to different mixtures of pollutants. This, of course, takes place not only outside, where we've got the internal combustion engine contributing to the pollutants, but also indoors. And here again, the inequality issue starts to come to the surface with poor housing and having housing close to roads and close to the areas where there are outdoor air pollutants, as well as poorly constructed buildings which are overcrowded, all leads to increased exposure. And in this middle diagram, you can see in a particular property here, a single house, we're looking at the nitrogen dioxide outside, which is in brown, and inside, which is in grey. And you can see there's a reasonable reflection of the outdoor air pollution inside. This is quite important because this is telling us that inside our own homes, our offices, the transport we move around in, we are being exposed to outdoor air pollution all the time. And this, of course, in an indoor space gets mixed with the indoor pollutants that are being emitted from the chemicals we are using in these environments. And of course, it's everybody that is affected by this, particularly young children whose organs are still developing. And indeed, air pollutants have now been shown to influence the development of organs in the developing baby in pregnant women. So it's very important that we now try and get to grips with this and realize that air pollution needs to be controlled and controlled properly. And one of the great things about all of this is that some of the targets now being set at COP26 for improving our carbon limits are the same targets which obviously are contributing to air pollution. The important thing about the health effects, however, is that the air pollution reduction would give immediate effects if the pollutants were reduced. So therefore, reducing some of the particulate and the gaseous pollutants contributing to the climate change issues we're all talking about at present would have a huge benefit on human health by cleaning up the air in parallel. But what we don't want to do is to have climate change targets that are going in the opposite direction to cleaning up the air. And one example of this would be sealing our homes, not allowing the indoor pollutants to escape outside and not having adequate ventilation of our homes. So if we really now start appreciating the importance of air pollution on human health, people will change their behavior, but they'll only do this if they see the behavior is easy, rewarding, empowering, and normal. The COP26 meeting is obviously shining a light on what we now need to do to help our Earth recover from the damage that we've all done to it over the many centuries of burning fossil fuels. And obviously cleaning up the air is one of those great steps that we can take that will make all the difference. Thank you very much. My name is Stephen Holgate, and I'm going to talk about air pollution and human health.
Contribution, actually, I'm sure we could all have listened to that twice, actually. It was so interesting, but also so harrowing. So inequality is really at the heart of all of this. Climate change directly causing physical illness. I would make a prediction that there is no illness, mental or physical, that won't be significantly affected by climate change. The evidence is emerging all the time, and no safe level of air pollution. That message is really very clear. So thank you, Stephen, for that. Let's move to our next speaker here now with us. Absolutely delighted to introduce Lisa Page. Lisa is a liaison psychiatrist and senior lecturer in medical education and psychiatry. She's also our college's associate registrar for sustainability, as well as the co-chair of the RCPsych Planetary Health and Sustainability Committee. Lisa, over to you, and thank you for all you've done for the college. Really tremendously grateful to you.
Thank you, Adrian. That's a very kind introduction. I'm actually going to stand because I need to have a little look at my slides over the shoulder. I'm not sure all of you can see them, so apologies if you can't see them very well, and I'm probably now in the way as well. So Okay, so I'm going to talk about so next slide, please. I'm going to talk about the mental health implications of climate change. We have been hearing about the physical health implications quite a bit. Well, I personally have here at POP, which is really great to hear. And I'm going to try and open your eyes a little bit to the mental health implications. Now, you may think that, or I think many people think about eco-distress, eco-anxiety, and think that is what we're talking about. And actually, it's not really what I'm talking about. I will touch on it at the end, but really I'm going to talk about much wider impacts on mental health that I think need to be recognised and talked about. And we can think of these in through two routes, the direct impacts and the indirect impacts. And I'll take these in turn. So next slide, please. So when we think about the direct impacts on mental health, we're talking a lot about how extreme weather events, such as, let's say, storms, so hurricanes, cyclones, extreme events that happen and then have really very significant impacts on mental health. And we know that we've got good quality evidence from across the world that reflects that. We've already been hearing about air pollution and its impacts across the life course, and that includes on mental disorders, neurodevelopmental and other disorders. And the evidence there is definitely accruing and strengthening all the time. We've also got to think about things like droughts, which perhaps there's less evidence for, less research done on, but we know that 19% of the land mass of the world was affected by drought in 2020. So it's a growing problem and increasing evidence around how that impacts on people's well-being and also actually can precipitate mental disorder. And we've got wildfires. Lots about that in the news and lots of evidence about how devastating that is for people particularly when they're directly affected by it and lose their homes. But I'm going to talk a little bit more about floods and heat because that's probably where most of the evidence, well, the strongest evidence certainly in the UK and Europe is. Floods, we know there's going to be more of them. They're going to be more, and they're going to be more of them, they're going to be worse, okay? And good evidence from around the world, but especially perhaps from the UK around the impacts that has on people's mental health. So a recent systematic review that was published a couple of years ago or last year showed that around, if you're flooded, then around 30% of people will develop PTSD and probably around 20% of people will develop either depression or anxiety. And that's much higher than baseline levels, obviously. And worryingly, many of those problems persist over time. So it's not just a short-lived effect. We see chronic impacts of that. I'm going to move on to heat and unpack that a little bit more. So can I have the next slide, please? So I think it's well recognized that heat has negative impacts on health when that heat goes above a certain threshold. And those thresholds will vary depending on where in the world you are. Now, this slide, again, it's another UK slide. So this is data that comes from the Office for National Statistics, and it's looking at data from summer 2020. And what it's showing, and you probably, apologies to those in the audience, you probably can't see this very well, you need to be a little bit nearer probably, is that it's tracking what was happening to temperatures across the summer. And that's shown in the amber and brown lines. And what the grey boxes are showing, the shaded areas, that is showing where there are heat wave events. So in 2020, there were 3 discrete heat wave events across the summer as defined by the Met Office. And what you see is that all-cause mortality goes up in those heat wave periods. And that is true when you, so this is, in other words, there is excess mortality during those heat wave events. And ONS calculated that there were over 2,500 excess deaths in summer 2020, just in England, okay? And that's mostly in the over 65s. But actually also we know from other evidence that it's not just the frail elderly, it is also people with major mental illness. So examples being dementia, severe and enduring illnesses like psychosis, and people with substance misuse problems. So it particularly affects people, the sorts of people that we see in our services in psychiatry and mental health services. So that's kind of all-cause mortality. Next slide, please. But actually, the evidence goes further than that. So there is now good systematic review evidence of increase in suicide when you see above a certain temperature threshold. Now, those thresholds will vary where you are in the world, but this data is coming from across the world. So we've got evidence from low and middle income countries, as well as higher income countries such as Australia, the UK, and North America. And one study which was published in Nature Climate Change a couple of years ago, data from 2018, estimated that if we did nothing, and if we didn't manage to make any to mitigate climate change at all from our current trajectory, then they predicted that there would be an additional, I'm going to want to get the number right here, 22,000 excess suicides in United States of America and Mexico between 2018 and 2050. So that's a very, very significant number. So which brings it into the ballpark of other social drivers of suicide, such as unemployment. So yes, the effect is small, but across large populations, it's significant. And that's what we need to remember here. So suicide, we know also there's emerging data that we get increased visits to emergency departments for mental health reasons and increased admissions to mental health facilities during periods of hot weather. And again, that comes from across the world. And I've already spoken about the increased mortality. But actually, so that's kind of stuff that we might think about as psychiatrists. But actually, if you look at general population, there's also evidence that it impacts negatively on emotional well-being. So emotional well-being reduces during times of unaccustomed hot weather. There's increases in negative emotion, and that's something that Lancet Countdown, for example, is now tracking, and is one of its indicators. So that's an overview of heat, very briefly. Can I have the next slide, please? We're now going to move on to the indirect effects, which I think actually are probably more significant, although less easy to measure in mental health terms, and perhaps less easy to bring together and present to you in a coherent in a coherent way. But actually, I think it would occur to all of you if we think about the sorts of changes that we're seeing in our world, why they're going to impact negatively on mental health outcomes. So land use change, when people are no longer able to live on land that they've lived on for generations and perhaps their families lived on, and they're having to change how they support themselves and their families. That leads to, that leads to mental health problems for people. Migration is a big topic, and there's lots written about it in relation to climate change. And I suppose just to sort of say that from a mental health point of view, forced migration, particularly migration that might involve unexpected migration or migration after conflict, really has very significant and very serious effects on mental health. And those effects can be to the degree of, leading to higher incidence of psychosis, for example, in migrated populations. Additionally, we know that urbanicity is also linked to increases in psychosis. So these are very significant mental health changes. It's not just short-term and transient. We've also got changing patterns of infectious disease, which are linked. So changes to malaria patterns, dengue patterns, all will impact on mental health, not only for those affected, but for the health services and for the people around those that get infectious disease. And we've recently had pretty dire predictions about increases in conflict as a result of climate change, and probably can't think of any other human activity that leads to more mental disorder than conflict. So I think that speaks for itself. And finally, we get to sort of eco-distress and eco-anxiety. And hopefully I've sort of shown you why I've left it to the end, because actually there's a lot more to say about the mental health impacts of climate change than just eco-distress and eco-anxiety, upsetting though they are to experience, and I might say as sane as they are to experience. So can I have the next slide, please? So quickly going to just talk about a few mental health solutions. I think actually Rosie's talked about these in much more eloquently, so I won't say too much, but just from a sort of psychiatrist mental health services point of view. Next point, please. So yeah, we can advocate as mental health workers, we can talk about this stuff. I think we can talk with confidence about what we do know about mental disorder, what we know about the solutions as well in terms of treatment. We would like to see a much greater emphasis on prevention of mental disorder across the board. And of course, one way of preventing the sorts of mental health problems I've been discussing would be if we could mitigate climate change effectively. Co-production, something we're very keen on, so involving the people that actually use our services in the design of those services makes for better services and leaner services. We would like to see a low carbon healthcare, and we've got a part to play in that in psychiatry just as much as any other part of medicine. We would like to see more social prescribing as an adjunct and an add-on to the sorts of treatments that we already have, and we would like to see that much more available for our patients. And we would also like to see a greater emphasis on nature-based interventions, so building the evidence for that and actually being able to deploy those interventions where necessary and where appropriate. Okay, next slide, please. That is my last slide, so I'm going to come to an end, and I'm going to say thank you very much for listening, and I'm going to hand back to Adrian.
Great. Well, thanks so much, Lisa. A real sort of whistle-stop tour, really, of everything to do with mental health and climate change. So I was totting them up as you were going along: anxiety, depression, PTSD, suicide, psychosis, and the important influence of forced migration and conflict in relation to mental disorder. So this is a real mental health issue. So thank you, Lisa. I'm sure we'll come back to those later on. So now I'm very much hoping that we can go over to Lynn Jones. Lynn is a child and adolescent psychiatrist, and whose work has taken her to Haiti, Bangladesh, and the Philippines. And we're hoping we're going to go live now to a refugee camp in Bosnia, where Lynn is currently working. So I know Lynn has been on the line earlier on, so I hope that she's there with us. So Lynn, over to you. Well, that's absolutely fantastic, Lynn. I don't know how much you can see of us. We can now see you.
I can see you, all three of you, and I hope you can see my screen. Can you see my screen?
We can. So
Much
thank you so much for joining us.
You don't need to see me. And to be clear, I'm not actually in a refugee camp. I'm in a very nice UNICEF office who have very kindly given me a space to do the recording. And I'm working in the Mother and Child Families Centre for the amazing welcome that Bosnians are giving to refugees on the borders. I'll come to that in a minute, because actually, I hope what I'm going to say will amplify the wonderful speeches we've had earlier. I spent most of my professional life establishing mental health programs in places like this. It's a refugee camp on the Somali border, and I thought some of my specific clinical experiences would help you understand the mental health dimensions of being a refugee or being displaced. It might also be a way of looking into our own possible futures, and I'm already having the glitch I feared. I'm sorry, the slides, for reasons I don't, it's advancing, good. I'm sure this audience does not need reminding that for millions of people, climate change is not a future threat, but a current catastrophe. I think that's been brought home. UNHCR says this is the defining crisis of our time. Climate fuel disasters were the #1 driver of internal displacement in the last decade. I should, by the way, say that I don't like the word climate change. I think it's totally inadequate. These disasters are the result of climate breakdown and ecological collapse, and I prefer the term planetary crisis to encompass both. So, as our previous speaker said, we can expect more of this. It's already driving millions from home. Last year, for example, 2020, even though most of us were locked down, Central America suffered the worst Atlantic hurricane season ever recorded, which displaced more than 500,000. And thank you, Adrian, and thank you, the Royal College of Psychiatrists, for the wonderful position statement. I was proud to be a little, one of the readers and text workers, and a lot of the things on this list have already been covered by previous speakers. So I want to just concentrate on two that I thought I would bring to life through clinical experience. Let's start with food insecurity, because unlike I was a medical student, used to get these graphs saying, oh yes, world hunger is decreasing. But in the last few years, world hunger has been steadily increasing, and it's going to get worse. It's already dreadful in Madagascar and has been for the last 4 years, and that is a climate-induced famine. So this is brought home to me in a very powerful way when I worked in Chad with the Darfur crisis. But before I talk specifically about this case, let me give you a quick reminder, those of you who aren't medics or doctors, I don't know who's listening, but the developing brain needs adequate nutrition, maternal love, play and stimulation. And if any of these are absent, there's likely to be lifelong damage and an enormous loss of human potential. And when I arrived at this refugee camp in Chad, and let's be clear, this was also a climate-exacerbated conflict, and it's still going on to this day, and 3 million people have been displaced and more than 500,000 killed. I met this extraordinary woman, Tabitha. I say extraordinary because she was really struggling, but she was surviving. She was confused. She was very depressed. And she was brought to me, and her baby was brought separately because she had basically abandoned her baby. She told me because the baby was dying and there was nothing she could do. So I managed to persuade both of them to get in our vehicle, and we took them to the therapeutic feeding center, which was really good at doing what therapeutic feeding centers did in those days, which was put, the right nutrients in the baby. What they didn't do so much of was any of the other stuff that we now know babies' brains need. And what struck me, and we were all really learning about this problem then, was the silence. The mothers had their babies in their arms, but they weren't playing with them, they weren't talking to them, they were low in mood, and there was no stimulation. Now, this led me into a kind of programming that I'm continuing to this day and doing in the mother and baby corner here in Bosnia, which is play and stimulation along with education on nutrition where it's needed. But this isn't the solution. We're going to have much worse problems than I saw in Chad if we don't address the drought and hunger that is being created right now by climate change. And let me come to the other thing. Anybody who's read anything I've written says, I know that PTSD and traumatic stress and acute stress problems are a major issue after conflict. I have witnessed them. And you've had the statistics in the previous talk. But what doesn't get talked about as a direct effect of conflict and disaster is grief and loss. It is the most important mental health effect. It's not a disorder. This little boy in this picture lost both his parents in Hurricane Haiyan because they couldn't swim and he could. And this was just one of a series of catastrophic hurricanes that's increased in frequency. He feels so strongly connected to them, he comes down to the grave every day to clean it. And you can see the destroyed school, destroyed community in the background. The pain caused by these kind of losses is completely normal. But recovery from grief comes from being able to properly mourn and properly get proper support from a surrounding community. The problem is, how do you mourn if you can't hold a funeral because your house has been destroyed? Or all the neighbours are also mourning because they can't come round because they're dealing with their own grief, so you don't have that community connection. And what if there's no body because it was lost at sea, or buried in a mass grave, or abandoned in flight? These are the problems of grief and loss that I don't see discussed, but I can assure you are major issues. As are the losses that occur even when no one dies. And this is a kind of cumulative list I make in every disaster I work in, but the core elements remain the same. People tell you, not that people have died, but they've lost their family, friends. The landscape is a big issue. Food is a big issue. But these internal losses of connection, security, identity, feeling in control, the future, and dignity, they are profound. And I think what this child said to me in Greece in 2016 sums up the indignity of the migrant crisis. The dog lives in a home. How come we live in tents? But I want to talk about two things I just see not really being discussed. And they're not mental disorders, they're not in ICD-11, DSM-5 as far as I know, although denial is something that we all understand since Freud. But to me, they are mental health issues, and they are going to kill us. Now, I'm not talking about denying that there's a planetary crisis. I think that reality is beginning to creep through. Rather, it's denial of the fundamental changes that are required to address in our way of life if we're going to address that crisis. It might explain why the first draft, as I understand, of COP26 decision text fails to mention fossil fuels, and why we have warnings of apocalyptic collapse. I'm glad to hear them if we don't change our ways. But at the same time, we're getting subsidies for short-haul flights. And by the way, as this little graph, which you can get from The Guardian, helpfully illustrates, flying from Rome to the UK emits more carbon dioxide than my Ethiopian mother-in-law emits in 1 year. If we carry on as we are, she is the one who is going to be forced to leave her home. And that's the other problem I want to bring up. Another mental health issue, which actually our previous speaker, I'm so glad she talked about violence and heat. But even without heat, we have a growing loss of empathy, a growing hostility to others. As Adrian said, right now I'm working with young children in Bosnia who have spent most of their lives on the move, 3, 4, 5 years, fleeing a conflict absolutely not of their making. They are on the borders of one of the richest parts of the world, the European Union, yet this is what they face. Migrants are not coming to steal from us. We are the thieves. First, we stole people and resources to build our industrialized economies, and now we steal life itself by exporting pollution and waste. I'm going to end with this amazing quote from the wonderful Somali-born poet, Wasan Shire. You have to understand, no one puts their children in a boat unless the water is safer than the land. If we continue on our current course, the land will be unsafe for us all. Thank you very much.
Well, Lynn, thank you so much for that really powerful talk and those very powerful messages, and putting really the food insecurity, hunger, drought and poverty right at the center of all of this. And those who are the least powerful in all of this are the people who, unfortunately, are the people who actually pay the biggest price in relation to climate change. So we're now going to move on to some questions, and we've got some questions that were prepared in advance. And we've obviously got the 3 of our speakers who will be able to take part in that. So the first question that we've had from Maria Elena Campos Ingram to all our speakers is, what is the one takeaway message from today's meeting, this meeting, and what would be your one call to action that people actually in the audience here or listening at home or later on, that they can take into their day-to-day lives, both their personal lives, but also their healthcare lives as well? So one takeaway message and one action that you think. I don't know, Rosie, do you want to start?
Okay, so I think the most important takeaway message, I mean, the harrowing stories that we've been hearing, it's very overwhelming, isn't it, to kind of take that on and realize just how serious the crisis we're in is now is the time to act. Now is the time to use your voice. Now you need to go out and talk about this issue with the people that maybe you're not in a position to be able to be powerful about the decisions you make, but you can influence people who are powerful, and you can take this message to them. And as a clinician, you should be thinking about who in your hospital trust, who can be doing that in your hospitals anywhere around the world. What is their plan and how are they adapting to this reality? Because this isn't going to go away, and we need to be thinking about that and taking that message to them and trying to both mitigate and adapt to low carbon resilient healthcare systems for the future so that we can live in a world where children have a future.
Okay, thanks. Lisa.
So I think I mean, it's a question that hopefully everyone's thinking about, having heard the presentations, and it's probably for you to take a view yourselves. But I would agree, I think, with Rosie about talking about this and feeling that you can talk about this in different parts of your life. So it's not just about what you might talk about with a like-minded friend, but you're able to just start joining the dots for people in your life who maybe don't otherwise see that. And that can be at work if you're a health professional. If you are a health professional, then yes, you've got individual actions you can take. You're a clinician, so think about carbon hotspots in your own services and what you can do about that. But also you're somewhat of a leader, and you're a very trusted leader being a health professional. So use that voice. If you're in research, think about whether you can do research that is useful for what we need to know for the future to manage to adapt, if we can manage to adapt, as well as to the problems that we've seen. And don't forget to get political about it, I think. So where, who can you pressurize? Who's in your world that you can pressurize? Who can you write to? Who can you contact? Who can you email? Who can you phone? And I think everyone needs to think for themselves who's in their orbit that they can contact and advocate in this about these issues.
Thanks, Lisa. And Lynn.
Yes, I agree with both the previous speakers, and particularly, I'm sorry, it may be uncomfortable for some, get political. By that, I mean quite simply, whoever and wherever your political representative is, find them, talk to them, write to them. If you're a health professional, you get listened to, and give them a health message. And the key health message I would like you to get across is that fossil fuels are a pollutant. The BBC had Arnold Schwarzenegger talking movingly about how he actually got California to declare that greenhouse gases were pollution. We've had that wonderful talk on air pollution. When I gave a talk in Belize on how air pollution is killing us and fossil fuels and diesel, which everybody is using, produces air pollution, it really cut through. And I think that's the message we can take. We can't go on digging this stuff out of the ground, not just for, it's killing us. And that's the message I hope you'll get across. Thank you.
Okay, for our next question, Lynn, I'm going to come straight back to you, so if you can stay on. So, and this is from Annie Mitchell, clinical and community psychologist with Extinction Rebellion Psychologists. So where and how do you think that healthcare professionals and other experts and citizens can best come together to make change happen? And what is our shared vision of success? I think we've touched a little bit on this, but how can we all come together and bring about the biggest change?
Oh, we do need to come together. And hello, Annie, and I'm in Extinction Rebellion, Doctors for Extinction Rebellion as well. And I hope as many people as possible will take action. I think, first of all, come together within whatever community you work in. If you're in a hospital, get the hospital together. I was very happy that my own trust had a day on sustainability a few years back now. We got wonderful college people who are sustainability down. Get together in groups where you feel comfortable. You may not want to be on the streets, but you can give a talk. Get a group together. And when you've got groups together, we need to get the groups together, as it were, and connect with one another. So it doesn't need to just be the activists on the street. I'm really glad that there's Psych Declares that connects with the college. We need to build, and it's easy with social media. I'm sitting here in Bosnia. We need to really connect these networks and then send powerful joint messages to our politicians. I think there is no substitute for a loud political voice and asking for meetings at a higher level. I mean, there are lots of lobbyists from fossil fuel here. I'm so glad the college is here and the health professionals are here talking jointly about the message. I'm not on the ground, but I would be networking like mad if I was saying, how can we continue this? How can we get together all these different groups? And let's have a big conference globally, it can be on Zoom, on how health professionals pull together on the climate planetary crisis and tackle our respective political leaderships. Let's do it.
Okay, let's do it indeed. Well, I'll put that on my list to go away and sort out. Lisa, what's on your list? Where do you, how do you think we can come together and bring about change?
I think it's about working in networks, isn't it? Which we're seeing happen, and whatever your professional body is, what are they doing, and beyond that, what networks are they working with, and if they aren't, then why aren't they? And up and up and up, and I think that's the only way to go. And it's certainly seemed to me here that the United Health voice is quite powerful, and I think will increasingly get listened to and if we can, if it's seen as a coherent voice asking for the same things, then I think there's no doubt it will get listened to.
Okay, great. Rosie.
Well, I don't think I've got much to add from what the other speakers have said, apart from what I think a measure of success would be, which is, I think we can measure success when health is central to everything we're doing. And at the moment, you know, it isn't, the irony is not lost on me that we are sitting across from Saudi Arabia pavilion, and, you know, health is not central to these discussions at COP. Health is a peripheral issue. And when health becomes a central issue to the way that we are thinking about the future, then we are meeting success. Children's future at the moment is not at the center of this. Money is at the center of this. And the capitalist system is at the center of this. And we are not thinking about the human cost. And our inaction is going to be paid in children's lives. And that's really, really fundamentally not acceptable to me or to any pediatrician I know. So let's get up and let's make change and make health voice powerfully heard.
So for those of you who are not here, and we're on the World Health Organization stand, and there are hundreds and hundreds, probably thousands of stands, and this is a tiny little stand. I expected the World Health Organization to have a huge stand, and somebody said to me at the beginning that they thought that the size of your stand was inversely proportional to your actual commitment to doing something about it. But anyway, I don't think there's any science around that, but actually I think they do have a point. Let's move on to a different question, and it's from Catherine. Do you think there could be value in school leavers participating in Planetary Health Service before entering into further education or employment? I think Rosie's got to come to you first.
Well, I certainly think that there could be value in empowering young people to find a way of taking action to deal with some of the problems that we're facing. One of the things that I feel a lot of people are angry about, and I often teach undergraduate medical students, and one of the things I've noticed is that often they're quite despondent and they're quite angry and they don't feel that people are taking action. So I think finding a way that people could contribute meaningfully is a really empowering way of helping them to see solutions to some of the issues that we're facing. I'm not really into mandating that to anybody. So I think that would be an optional thing for people to think about. But I certainly think that there would be a value in action, because one of the things that we feel so powerless about is that this is something way beyond our ability to influence, and it's happening to us.
Okay, great. Thanks, Lisa.
Yes, it's not a suggestion I've heard before. I think we do know that for many young people, there's a lot of fear and a lot of anxiety, and to some young people living in developed contexts, there's some guilt as well. And you know, we know that taking positive steps, taking action, even small actions, can be really helpful for helping manage those sorts of difficult emotions. I suppose I'd be reluctant to put more emphasis on action that young people need to take when it's older people in power who really need to take the action. So I suppose that would be my only sort of pushback on it.
So I think it's people like me at the end of their career who we should be taking a year out and getting more active. Maybe that should be, we'll take that one back as well. Lynn, what do you think?
Well, it offers an opportunity for nature connectedness and planetary connectedness. And I mean, I don't know about mandating, but I think the opportunity and providing the opportunity to do planetary service, whether it's for an older generation or a younger generation, like BSO, but with a nature saving the planet focus, would be amazing. And I think many young people who don't have the means or finances to do that sort of thing would love to be given the opportunity. I'm involved in nature connectedness projects, both in schools in the UK, but also with refugee children. And I see the brilliant things you can do if you just get people out into nature. It's not a new idea, it's not mine. So if this is another way of actually enhancing that side of it, I'm all for it, as well as the fact that the more of us who can take care of the world we live in, the better.
Okay, now to our very last question, and it's from Stuart. How can we make healthcare delivery much more communal and inclusive rather than so focused on treating the individual? Make health of the person and the planet a real collective priority. And Lynn, I'm going to come to you first.
Well, in a sense, it's what I'm trying. I so agree. I mean, I've got much more involved in trying to do preventive, nature connected. I'm working two things here. One is a camera workshop with children, and one of the things I've done in the UK is nature photography, where we get children to go out and focus and take pictures of things they love and then talk about them. And that, it's not my original idea, that connects them more deeply to the environment and they feel much better and their mental health improves. And I wish we could do, that's a tiny drop in the ocean. The more forest schools, the more collective, socially engaging, nature connected work we could do, the better it will be for our health, the planet's health. And I think it's good for every age group. And I think the evidence is beginning to be there. So take a preventive focus, take a nature focus, take a socially and nature connected focus as well. And let's shift away from individualized medicine. And obviously we can't, but let's put that in and let's mandate it and let's make it part of a doctor's training agenda.
Okay, so yeah, let's get it on the curriculum. We're certainly doing that at the college in relation to the college curriculum. So Lisa.
Yes, so thumbs up to nature, I think that sounds a good idea. I think the only other thing I'd say is going back to that point about using the voice and experiences of people who use your services to help develop them. I think that can help in that direction that Stuart's asking about.
Rosie.
Yeah, I really think that making sure that whatever services we're designing have the voice of the users involved in, and that can be quite difficult when you're designing services when you're looking at sort of neonatal services, because obviously the people can't speak. But what we do know is that if you design services which do have nature in them, that has multiple benefits, and almost all neonatologists, I don't know how many are watching this, will definitely realize that we so often have neonatal units which have no green space surrounding them. Even if it's outside the window, there's no access for parents to be able to go into a green space and just connect to nature. And for months, they are inside these neonatal units, completely removed from anything natural. And that has psychological effects which affect their ability to bond with the children. So I think we need to make sure that services are both working within the communities that they're being built, but also work with the natural systems that we have in place.
Okay, that's great. We've come to the end of our session. I'm just going to turn to each of our speakers. First of all, say thank you to all of you for your contributions and, more importantly, the work that you're doing. But just one final point that each of you want to make to our audience. So, Lynn, what's the last point that you really want to get across? I think, Lynn, we can't hear you.
Me? Yeah.
Yeah, we can now. We can, yep, with a...
It's not hopeless. And there's nothing more empowering than like being at a meeting like this, getting feedback from you, hearing my colleagues speak, feeling I'm part of a network of people who care about the things I care about and want to act. And collectively, there's nothing we can't achieve. They may not be getting it right in COP. We can make them get it right. We've still got time. Don't let's be tricked or duped. Let's deal with this planetary crisis denial disorder that I've invented, and let's get the truth out there and let's show them what's needed, and let's do it together. Thanks very much.
Thanks so much, Lynn. Lisa.
I think just let's all keep working in this space. Let's all keep doing what we can do. That will vary for each of us. So we're all coming at it from different angles, different backgrounds, different professions, different groupings. But keep working, keep going. And if you need to pause because it's getting too overwhelming, do that, but then come back and keep going. And you know, it's not an option to stop. I don't think. You just have to keep at it.
Great. Finally, Rosie.
Just that there are huge co-benefits here, that we have the ability to make healthy futures which are also low carbon, and those two things don't need to be mutually exclusive. So combining those things and working together, and I'm really pleased to be, you know, with other members of other colleges here, because it is, you're not alone. You've got a whole group of people around you who care about this issue, and actually that's really powerful. All the thousands of people are here. We can make a difference, and don't be disheartened. Great. Well, a bit of optimism there to finish on. So thank you so much to our speakers.
Thank you so much to you, the audience, for coming, those watching at home or later on. Thank you to those who've asked questions. Most importantly, thanks for all that you're doing in this area. I think what I've heard is that we need to really stick together on this. I think there is a growing community that is demanding change, and we are a very powerful group, and we've got to make sure we get those messages out there. So thank you so much, and safe journey back to wherever you're going. Thank you.